Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
1991, my father, who you know I adored, we just lost him a year and a half ago. We brought him to Dr. Lederman. You need to bring yourself or someone you know who needs to have the barnacles scraped off their backside to get their rear in gear and walk in there right now because Dr. Gil Lederman is New York's only triple board certified Harvard-trained radiation oncologist, first brought the non-invasive stereotactic body radiosurgery to America, and he's got the longest experience treating cancer using radiosurgery. So look, do yourself a favor. If it's cancer-related, and I'm talking breast, lung, pancreas, liver, kidney cancers, and more, you got to bring it to Dr. Gil Lederman. He'll send you an informative booklet DVD. You watch it first, you read, you sit down one-on-one with Doc Lederman, and then you prepare for what it is you want to do and you should be doing. Just call Dr. Gil Lederman at 212-CHOICES. Set up that appointment today, 212-CHOICES, or set it up for someone you know won't do it for themselves. At 212-CHOICES, that's 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple-board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. It's Gil Lederman. I hope you're up bright and early. Early for sure, getting brighter. Yes, my name is Dr. Lederman, and I'm live. You're welcome to call us if you have questions or comments or concerns. We're live, broadcasting from WABC Studio. Our number is 1-800-848-9222. 800-848-9222. And we're talking about a lot of cases today, interesting cases and interesting news. And the idea here is to give you information, education, and the confidence to have a better life and a better health care and better treatment for yourself. And you'll see what happens to other people in the medical system and kind of get an idea how it might be best for you to operate. So we're going to jump right in and talk about a patient I just saw yesterday. This is a woman from Ecuador. She's a 67-year-old woman from Ecuador, married with 2 children. She came with her grandchild and her niece for consultation for a left breast cancer. So she was sent by the surgeon who removed the lump of cancer. She had been seen by the medical oncologist also. So I didn't have any paperwork, and very commonly patients come, and most patients, it seems, do not have their paperwork. And advice number 1 for all of you, just get like a ledger, like a bookkeeper would have, and put in all your paperwork, your blood tests, CAT scans, bone scans, MRIs, biopsies. Get them all and just keep them there. And when you see the doctor, you can take them in and you'll have them all available. Now, we find patients aren't even given the documents, and when you're not given the documents, you can't have the documents. So there's certainly a way to get them, and that is to come and see us. So So this woman came in, and she was told she had a 5-centimeter cancer in the breast. Well, 5 centimeters is a T3 breast cancer. It's an advanced stage breast cancer. And then she showed me her mammogram. She did have her mammogram pictures in her possession. And I looked at them, and the tumor was small, and it didn't make sense. The size of the tumor that she was told by her doctors was large, and the size on the mammograms was small. Well, of course, like in every patient, we got the documents, and we shared the documents, and the patient had the documents, and then we called the pathologist. And wow, what a difference facts make. So she was told she had a 5-centimeter tumor. The doctor herself, the doctor herself told me the cancer was 5 centimeters. She explained, it's a very, very big cancer, but it hasn't traveled to the lymph nodes. Well, we're getting the documents, and we're like Sherlock Holmes, and that's something what a doctor has to be, and a doctor has to have time to do it. So if you're seeing someone who's not giving you the time, you're probably not going to get the facts. So time equals facts, equals good care, equals questions. We got the facts, and no, the cancer wasn't 5 centimeters. The doctor misinterpreted the pathology report. The pathology report, which I shared with the patient, she has a copy, said the amount of tissue taken out was 5 centimeters. The cancer was 1.7 centimeters. So, wow, she already went from a T3 breast cancer down to a T1 breast cancer. So already the prognosis is much better. The treatment's much different. The other doctor was planning to give her chemo because she has such a massive tumor, and now she only has a T1 tumor. So, wow, how treatment changes with the facts. So we explained treatment and options for women with lumpectomy. We explained how radiation is useful to help prevent the cancer from coming back. We explained that women who have lumpectomy, removing the little lump of cancer, followed by radiation, gives better results actually than if you remove the whole breast, and we discussed that several weeks ago on this show. So how can that be? How can we, with lumpectomy and radiation, give better results than removing the whole breast? Some women think it doesn't make sense. The facts are the facts. And there's been hundreds, thousands of women studied, and there's no need for most women to remove the breast. You heard right. There's no need for most women to remove the breast. The vast majority of women who have breast cancer can keep the breast, can keep the nipple areolar complex, can keep the sensation, can keep the form, can keep their own breast, and have better results than if they removed the breast. So please do not jump in and just say cut them off. That's not the right answer. You can do what you want. It's a free country, but if you knew the facts, and that's why we're here, you'll see there's no reason for the vast majority of women to have a mastectomy. Better results, better form. When you get into your dress every night and every morning, you won't have that reminder that you had that big breast cancer back then in 2014, and you have a better chance of living. So for this patient, she was happy. I said, do you want to come to me or someone else? And she said she wants to come to me. Yeah, why? Because she went from a T3 stage down to a T1 stage. Her prognosis jumped up. She can keep her breast. She can have better results. She can probably avoid that chemo that was being planned. Wow, what a difference the facts make. And that is good news versus what could have been bad news for this patient. We have a caller on the line, so we're going to take the caller and move on. So, hello, good morning. Good morning, operator. It's a dead line. So if
No,
you want...
it's not.
Oh, I thought it was a dead line. We've got a dead line.
No, it's not a dead line.
Okay, how are you? What's your name? Hi, Diane. What's up?
Okay, I don't know too much about this case except that I have a friend who lives upstate who he got hepatitis C from something a doctor had done years ago.
Sorry to hear that.
And now he has an inoperable liver tumor. And
liver cancer.
Liver cancer, yes.
Yeah, tumor can be benign or malignant, but cancer is malignant.
Yeah.
And people with hepatitis get primary hepatocellular cancers.
Right. So, I mean, he's on like a whole lot of medications. What else could be done?
Well, there's a variety of options for primary hepatocellular cancers. Actually, I was going to talk about it later in the show because there's a study about how to prevent primary hepatocellular cancers from expanding in people with cirrhosis. But surgery can be done for some people. The problem is when people have cirrhosis, their liver is sick, and most surgeons don't want to operate, and most patients don't want to go through that. You said it's a large tumor, so larger tumors are more difficult to treat with surgery. Chemo is not very effective. It's marginally effective.
They said it's inoperable.
Right. Well, inoperable means what I just said, that it's too big to cut out or the patient is too sick. We actually have a very large experience treating patients with liver cancer and liver metastasis with radiosurgery. So radiosurgery is a non-invasive method of treatment. It allows us to hit the cancer without hurting the healthy tissues. It's 5 treatments. Our success rate, meaning stopping, shrinking, or making the cancer go away, is about 90% where we aim the beam. So it's very successfully performed. We treat primary liver cancers most every day of the week, and that's what we're dedicated for, is non-invasive treatment.
So are you saying that something that would be inoperable would be you could take care of?
Oh, yeah, it's all the time. Remember, inoperable means you can't put the person to sleep and open up their body and cut out the cancer. So that's mechanical removal of a tumor. It's very invasive and it's very toxic. And for someone who's probably sick with liver disease, it's probably would create more problems than solutions.
His wife said that he seems very healthy, though.
Well, that's
like
a good
a
sign.
Sick person.
Yeah, that's a good sign. Anyway, our treatment, fractionated radiosurgery, which is a technology that we brought to this country almost 20 years ago, allows us to treat cancers non-invasively. So we make a stereotactic frame. So it's a frame that's custom molded around the patient. It's totally non-invasive. There's no cutting, no bleeding, no operations, no anesthesia. Patients come in, get a treatment. It takes about 15 minutes. We aim the treatment at the cancer. They get up and they go to cross the street shopping at Macy's or go back to work or go home or whatever they want to do. But the treatment is very, very well tolerated.
So you're saying you use radiation?
It's a fancy form of radiation.
What sort of form?
Well, it's called radiosurgery. Standard radiation radiates a lot of healthy tissue to get to the cancer.
Right.
Fractionated radiosurgery allows us to aim the beam just at the cancer. So beams come from many, many different angles to hit the cancer. They all converge on the cancer, so the cancer gets the full prescribed dose, and the healthy tissue gets inconsequential dose of radiation. It's very well tolerated, as I say. There's no cutting or bleeding or hospital stay.
Could I ask you something, sir? Doctor, can you get a secondary cancer from this radiation?
Oh, it's possible. Personally, I've never seen it happen with radiosurgery, and the reason is secondary cancers are more common with standard radiation, which is large areas of the body getting radiated over weeks and weeks. With radiosurgery, we're aiming the beam just at the cancer area. So the likelihood, in my experience, and I've treated about 20,000 patients like this person, I just haven't seen it, and we follow our patients diligently. We usually follow our patients every 3 months. So we are keeping on top of our patients and know what goes on with our patients. And
do you take insurance?
Yeah, we take most insurances, Medicare, Medicaid.
How would I get in touch with? How would if I mention this to them? How would they get in touch with you?
That number 212-CHOICES, which is 212-246-4237.
CH.
Two and two choices.
CHOICES?
CHOICENS.